Let's talk about something that so many families face, but often in a moment of crisis: the cost of long-term nursing home care. It can feel like this absolutely insurmountable mountain. But today, we're going to give you the map to help navigate it.
I mean, this is it, right? This is the question that keeps people up at night. The cost of that kind of round-the-clock care, it's not just high, it can literally wipe out a lifetime of savings. It's an incredibly daunting thought. But, just understanding the system, that's the very first step toward getting a handle on it.
So, where do you turn when the savings run dry? For millions of Americans, the answer is Medicaid. But this isn't just some other insurance plan. It's a critical lifeline, really, designed for exactly this kind of situation, even though it's one of the most misunderstood programs out there.
So what exactly is Medicaid? Well, at its heart, it's a public health insurance program. But the two things you really need to remember are these. One, it's a partnership between the federal government and each state. And two, it's means tested. That's just a way of saying it's specifically for folks with limited income and resources.
Okay, now this slide is so important because it clears up a massive, massive point of confusion. People mix up Medicaid and Medicare all the time. But look at the difference here. Original Medicare does not cover long-term care, period. It might cover a short stint, up to 100 days in a skilled nursing facility after a hospital stay, but that's it. Medicaid, on the other hand, it can cover 100% of the costs for as long as it's medically necessary. That's a total game changer.
So, how do you get this coverage? Well, this is where it starts to get a little tricky. Qualifying for Medicaid for nursing home care isn't like signing up for a new phone plan. It's more like running a gauntlet with some really strict rules you have to navigate very carefully.
And here it is. This is the single most important rule to burn into your brain. Medicaid is run by each state. That means the rules in California are different from the rules in Florida, which are different from the rules in Ohio. The income limits, the asset rules, the application process, it's all local. This is not a one-size-fits-all deal.
And this chart right here, this really explains why the rules are so strict. Just look at these numbers. Seniors and people with disabilities, they make up just about a fifth of all the people on Medicaid. But their care, which is often very intensive long-term care, accounts for over half of all the money Medicaid spends. The financial stakes here are just enormous.
Okay, so the first big hurdle you have to clear is proving you actually need the care. This is what's called the level of care criteria. A state-approved professional will do an assessment to confirm that, yes, this person truly needs 24/7 nursing home care. You can't qualify just because of your finances. You have to have a real medical need.
So, once the medical need is established, you hit that second hurdle, the financial criteria. This is where those strict state-specific limits on income and assets come in. We're talking about how much money you have coming in every month and the total value of everything you own. Bank accounts, property, the whole shebang.
And listen up, because this next rule trips up so many families. You can't just give away your money or your house to your kids to qualify. States have what's called a 5-year look-back period. They will go through 5 years of your financial records with a fine-tooth comb. If they see you gave away assets or sold them for way less than they were worth, you could face a penalty period where you're ineligible for coverage, even if you're flat broke.
So, what happens if your assets are just a little bit too high to qualify? Well, there's a process for that called the Medicaid Spend Down. It works like this. Say your state's asset limit is $2,000, but you have $20,000 in savings. You would pay for your nursing home care out of your own pocket until those savings have been spent down to that $2,000 limit. The moment you hit that number, you become financially eligible, and Medicaid can start picking up the bill from then on.
Okay, let's say you've navigated the gauntlet. You've been approved. Great. So, what does Medicaid actually pay for once you're in the nursing home? Let's take a look.
You know, the coverage is actually really comprehensive. It covers all the big stuff you'd expect: the room, the 24/7 nursing care, meals, and all your medications. But it also goes further, covering things like physical therapy to help you recover and even emergency dental work. Basically, if it's considered medically necessary for your health and well-being, it's generally covered.
But, and this is an important but, it doesn't cover personal comforts or little luxuries. Things like getting a private room, special order food, fancy grooming products, or even your newspaper. Those are things that Medicaid won't pay for. Those are considered extra personal expenses. All right, we've come to the final and, maybe the most personal part of this whole journey: finding the right facility. Getting the finances in order is a puzzle for sure,
But choosing the place where your loved one is going to live, that's a decision that carries a whole lot of emotional weight.
So here's your very first filter for your search, and this one is absolutely non-negotiable. Not every nursing home takes Medicaid. To even be on your list, a facility has to be officially licensed and certified as a Medicaid nursing facility. Confirming that status should be the very first thing you do.
And when you're touring these places, you really have to be an advocate. This slide is your checklist. Don't just ask if they're certified. Ask about staffing ratios and turnover. That tells you so much about the quality of care. Ask about their activities. Ask about visitation. And super important, ask, who do I talk to if there's a problem? Be thorough. Be relentless.
And all of this really brings us back to our most important takeaway. And this quote just says it perfectly. If you remember only one thing today, please let it be this. All Medicaid rules are local. Guides like this are great to get you started, but the only information that truly matters is the information that comes directly from your state's Medicaid agency.
And so that leaves us with this question. Way too often, these are conversations that families are forced to have during a crisis. But understanding this landscape, understanding how Medicaid works before you need it, is one of the most powerful things you can do for your family and for yourself. So, is your family prepared? It's one of the most important conversations you'll ever have.